Hi, I'm Kathy Haushin. I'm the VP of Strategy and Business Development at Incubator. We're proud to be a diamond sponsor at HCIC and the sponsor of this track. At Incubator, our motto is Dream, Build, Grow. Let's bring your digital vision to life, and that's exactly what we've done for about 15 years. We help our client partners in and outside of healthcare, and we build and enhance and support their websites, mobile apps, and in some case, even custom portals. So just a few housekeeping items. There's a survey at the end of the session, so if you guys could fill that out, that's really helpful for the Greystone team and the people sponsoring the events. And with that, I'll turn it over to Bryce and Wade to introduce themselves. They will be speaking about building the future, designing a scalable multi-year web strategy for health systems.
Hi everybody, thanks for joining us. Wade Holdraker. I am the AVP of Digital Strategy and Web Operations for the University of Rochester Medical Center. I appreciate you guys being with us today. I know there's a lot of great sessions going on, so I appreciate you guys coming to this. I'm going to apologize ahead of time. I am losing my voice, so I'm glad I'm on the first day today. I wish it was a fun Vegas story, but it's not. It is a lot of air travel yesterday like everybody else had, and a 3-hour time delay and a really bad night of sleep. So we're going to try to get through it, but if you can't hear me, just raise your hand or something. I'm joined by...
Hi everybody, I'm Bryce Cannon, President at Modea, and I'll introduce Modea in a slide here, but good to see everyone. Thanks for coming to the session.
So first thing, just a quick setup. URMC is a academic medical center. We have 27,000 employees, one of the largest employers in upstate New York. We are a part of 8 hospital system. Something that makes us a little bit more unique is that we have a passive parent relationship with our hospitals. So that means we do not own any of our hospitals. So each hospital has their own board of directors and CEO and everything, which makes a transformation project like this super complex.
Yeah, and just quickly about Modea. So we're a digital product consultancy, and that's sort of a fancy way of saying that we help our clients develop strategies and then ultimately design and build digital experiences, digital solutions. We operate exclusively in the healthcare industry, so all of our customers, or most of our customers, are large health systems like University of Rochester Medical Center. And we've been doing this for almost 20 years now, and I've actually been working with Wade for, geez, feels like half of that almost, but yeah, really excited to talk about web strategy here today.
Yeah, so when Bryce and I were putting this together, we were talking about, we didn't want to make this just a case study because, we are not perfect. I'm going to be the first one to tell you right now, we are not perfect as an organization. But we've learned a lot of lessons along the way. Hopefully share some helpful tips for you guys today. I really want to make this conversational. So at any point during the presentation, if you guys have questions, feel free. We will have Q&A at the end, but really my whole thing about being at this conference is getting to meet others, building my peer network, talking about things that really matter to all of us. How many times over the last couple of years, whether it was data privacy, security, accessibility, have you had questions like, what are others doing? And so trying to answer some of those questions today, hopefully give you some tips. So the first thing, and this is one place where we failed in the beginning, is we had to stop treating our transformation like a project. It's a program. There's no start and end, right? I don't know how many people have been asked in a transformation project like ours, when is the website going to be done? Right? When is the website going to be done? Well, when is healthcare going to stop changing, right? So that's one of the things is trying to change the mindset of our organization to really not think of it as a project, but really as a program. So the model that we've been really following over these years is really this build, measure, learn, optimize, repeat, and just kind of this constant evolution, as you'll see here. So from the research side, and I'll get into each one of these in a second, but research really kind of begins with user insights. So one of the things we did with Modea, and Bryce will talk about in a second, is we spent a lot of time informing our work with research. Building, measuring, learning, optimizing, I'll get into each one of those. So how did we apply this loop?
Yeah, we really, as Wade just said, we started, this goes all the way back to, I think, 2018 was when we started this process. of taking stock of where the web platform was at that time, how you all were meeting the needs of your customers. And we started with a whole bunch of research, as you can see here, just really trying to understand, what the different audiences that a complex academic medical center is what audiences they're trying to serve and what their needs are, especially as it relates to using the web or using digital solutions to engage with and develop a strong relationship with the health system. So across the gamut of talking to consumers one-on-one, looking at the data, and just really diving deep in both a qualitative and quantitative way to understand those needs pretty intimately before we started applying, coming up with the insights and deciding what to do about it.
Yeah, we spent almost a year on the research end of this, which is unheard of a transformation project like ours. Our institution always kind of, the website really mirrored what our internal foundation organization looked like, which was a disaster.
Yep.
And so this research really helped to inform kind of the project and where it went. And this is a constant loop too, as I kind of showed, that constant loop. Constantly as we're releasing new things, we're getting user feedback immediately on that to see if it works. So this is not a one-time activity.
Yeah, the other thing I'll say is, I remember you talking about this when we first started this work, is that how challenging it can be working with faculty and working with doctors, department leaders, and getting them to buy into what we might want to do with the web or go with these solutions. And this data was so critical to helping bring them along in that conversation and help them understand that we need to put the consumers and their needs first as we're coming up with the right solutions.
Yeah, absolutely. I don't know if I agree with your fact, like the whole provider thing being great, but we're getting there. No, the one thing that was good about this research too is that it told us a story during a really difficult time during COVID. So on the clinical side, it was all about transactions, getting people to appointment data, to our doctors, to locations, to phone numbers quickly. On the education side, it was the complete opposite. They wanted to feel that emotional connection. They wanted to know what it was like to be there, to learn, to live there. And with COVID, that was something that was gone. All of our tours went away. So we had to shift quickly and really present that experience on the web because they weren't able to be in person. So what we got out of the research there really definitely helped us get through that. We actually wanted to do something that was more authentic. So we gave our learners GoPro cameras so they could go around and actually show people what it was like being there every day. Something else that's really evolved over the last couple of years is our vision. So everyone's like, oh, vision. Vision's important. Really every stakeholder presentation I have, even to this day, I talk about our vision. And everyone's probably groans and is like, vision. But it sets the stage for what we're doing. And it really reinforces why we're doing it. Our vision is really evolved over the years. It started as turning our overly complex website into something that was manageable. That was our original vision, something to that effect. And as things like data security, privacy, accessibility all came in, we had to work that into our vision and reinforce what we were doing. So I'm going to take you through the loop here. So build. First of all, just a transformation project we had to get done. This program really, we had kind of an end date to start something because, like I said before, everyone just wants to know when the website's going to be done. But once we launched, we kind of got into this really good pattern where we focused on what could we launch, how can we improve this process every 90 days or every quarter. And so we really focused our roadmap on that. So for us, it was find a provider, which still is a struggle, and I'm sure everybody in this room is still trying to figure out find a provider. It's not easy. Search. So one thing I think we've done really well is really improved our search over the last couple of years. And we moved from a condition-based to a condition-based architecture. So like as before, our website reflected who we were internally. So it was all department-based. And our users said, we don't get it. So that was a big shift for us, and it was a huge content lift for us. So these immediate go lives, and then we use existing tech. And I'll get into this a little bit why we did this. But if you listened to Dave Feinberg before, there's the shiny new technology. Everyone's like, we need that. We want that. But we earned a lot of trust from our senior leadership group and our CFO especially by using what we had and making it work to the best of its ability. We were not utilizing everything, and so we made it work for a while, and I'll get into that in a second. So measure. This is a really big thing, and I'm going to show you why in a second. So I am lucky enough to report up to our CFO, which could be bad, could be good, but it's been good in our case. And I don't know, we've gone from a place where we used to report on metrics, and the one I always use is time on page, right? You can make whatever you want for time on page. Remember that? You say, oh, they were super engaged in the content. They were on our page forever. Great news. Or they found what they needed right away, so they quickly got off our page, right? So you can tell that story however you want. And so we wanted to shift from that story and really understand, like, how do we translate this to senior leadership? And again, Dave Feinberg said this in his presentation too. It's less about the numbers. It's understanding what do they care about. They care about access. They care about money. So rather than saying, we got 20% more traffic, it means nothing to them. But what does mean something to them is we got 3,000 more patients in the door, right? So it's really how you tell the story. We also acknowledge trade-offs. We acknowledge when things weren't going right and where we need to pause things and have to restart. Showing the impact and activity, so tying every metric back to patient experience, efficiency, making sure that our dashboards tell what happened and, stories that really explain why it matters. So that those stories were really a big part of this. And then balancing wins with gaps, so celebrating success but highlighting the next opportunity. So every dashboard that we have ends with, and here's the next opportunity. Learn, so capturing what's working, what's not. So we quickly learned that our content was extremely decentralized, diluted SEO, really was all over the place. So our team really worked on creating condition and treatment hubs, bringing all of our content together, social, video, all of our healthy living stories all into one centralized hub so we could better track all of those users and data. We discovered very quickly that all of the internal stakeholder complaints were actually foundational structure things, and that's something we're still dealing with. So we're on the front end. We get all the complaints. We're the front line to that. But the good news is that it highlighted some things that we could really do better operationally. So that's led to things like starting to improve our provider scheduling templates. They're pretty messy right now. So there's some things that we've learned on the front end that really helped us move on the back end. And then each sprint that we have ends in a feedback loop. So we constantly are saying what went well, where do we need to adjust, how do we need to reprioritize. So here are the results. So this is our team in 2018. We had 6 people. And from what a lot of hearing today, a lot of people are also around that. Some have smaller teams, some have larger teams. Again, by doing these trade-offs and building kind of this relationship with our senior staff, we've gone from 6 in 2018 to now about to be 19 on our team. And we did that through a really good storytelling. We did that through kind of showing the data and how it's supporting it, and really why digital was so important. And I'll get to that in a second too. We also did a really good job in the beginning of optimizing resource allocation. So working with Modea to help kind of to supplement some of the places we weren't ready to grow. Also finding IT support and others. Because I care when I go to this, I always want to talk to people. I want to understand what others are doing. This is what our team looks like. We are pretty large right now, which is very impressive. But we've done it in a way where we are slowly growing. We weren't adding to the organization in ways where we weren't mature enough yet. So one of the first things we did was we brought in digital content strategists because our content was a mess and we needed help there. And so we brought in content strategists to help build those hub pages. We brought in digital compliance last year with the data security and data privacy. That was something we didn't have, and that was a big gap we needed to fill. And so we had somebody come in for that. We've also integrated teams. So we brought in performance marketing. So we're part of, just to let you guys know, we're part of strategic communications. So it's communications, marketing, web, and performance marketing, social media, all sat in that group. We brought them over to be part of the digital experience. And then as we look forward, we're going to be hopefully resourcing digital asset management, search, and geo. Yeah. You can interrupt anytime, yes. Yep. Those are our doers. So those are the people who are managing our content and our relationships and doing the web publishing.
So why are they called just like senior web strategists? Is that if they're content managers or whatever? So what was it?
HR. It's a total HR thing. We're also aligned with the University of Rochester. We did a whole career path modernization project where they kind of retitled everybody, and they had to match up with the university, and the university kind of led that. So that's why they're called what they are. Yes. But I would still call them strategists, and here's why. And I'll get to you. There's a slide on this, but before we were request takers. We were a group of people who took tickets and did what people asked us to do. We've turned our team into strategists, and I'll tell you why in a second. But first, so just some numbers on kind of where we are today. 135% overall conversion rate increase since we launched the site in 2023. 99.3% of our internal search queries are leading to the right place now. That was probably close to 30 to 40% when we started. We have increase of organic search keyword position by 27% and search conversions to 8%.
Maybe I can hit it on the next slide, Wade, but I think one thing maybe that's important to note, we'll get into this a little bit as we get into the things we learned and things we're working on now, but you're seeing a lot of clinical site information. We're talking a lot about the clinical experience patient facing. Part of the research work and the vision at the beginning was a clear prioritization of focus and resources on the clinical experience first and foremost. URMC is a big, complicated academic medical center, passive parent with the university. There's all kinds of websites in the mix, and it's a massive ecosystem represented across the web, but we started here with clinical because that's what was going to resonate the most with leadership, and also drive the most business value in the near term for the organization. With limited resources, a 6-person team at that point, it really had to be laser focused.
And it also accounted for 88% of our traffic to the site.
Yeah.
So lessons we've learned along the way. So first of all, communication, transparency. This is a big thing. So the nice thing is that we're part of a communications team. So we had a whole bunch of communications reps who could help us with our communications plan. It really made sure that everyone was informed, everybody understood. We had frequent touch points with different groups. We identified which groups we needed to speak with. And we tailored our communications for those groups. So we talked about what mattered to those groups. The biggest lesson that I think, and the thing that that I always point to that really helped our program succeed, is that we included engaged senior leaders. What do I mean by engaged? The ones who are going to be the most difficult, right? These are the leaders who will disrupt the project or disrupt the process at some point, the transformation. So we gave senior leaders a voice. A lot of them we included in our governance. And amazingly, they all became advocates for the project because they understood it and they had a voice in it. Now, it's really tricky to find the balance between including them and letting them dictate the project. And so that's something that was one of our struggles, and I'll get to that in a little bit. But that's one of the places where we were really challenged to find that nice balance. All right, now to the strategy part. Why do we call our team strategists? Like I said, we were before reactive intake process. Prioritization was driven by budgets or the loudest voice in the room. Sound familiar? There was really no authority to say no to people. And what we've done is we've tried to empower our team. So rather than our leadership team always telling the story, we have our people tell the story. And we refer that to them as the experts. So when somebody asks a question, we say, let me talk to Lauren. She's kind of really the expert on this. And we kept saying that to people, and people started picking up on it. So rather than it's the request taker at the end of this ticketing process, it's the expert on that process. So that's, even though it was an HR change, it really kind of led to where we wanted to be. We also created a lot of clear, transparent decision trees, which at the end of this presentation, there's a QR code, and we give kind of a transparent, what's that? Transparent, that threw me completely. Decision trees at the end of the presentation. And then We shifted from volume and influence to value and impact. So again, trying to take kind of the departments who had budget to those who actually needed it. So one of the things we've taught our whole group to do is really educate and ask questions. Again, another thing you can't do through a ticketing system. So with the decision trees that you'll see at the end, they're really focused on, do we even have access in this area? So when we talk about performance marketing, when we're looking at even some of the ticket requests we get, do we have access? What are we doing with this? What's the purpose? And again, Dave Feinstein said this earlier. You have to ask these questions, or you just become a team of doers. Does this align with institutional priorities? Does it improve the user experience? Are there measurable goals or outcomes?
One thing I wanted to say on that slide, Wade, is I know you can't really see the diagram down here to the right. We'll talk about this at the end of the presentation, but Wade has actually put together some examples of these decision trees that they use in their organization that we are going to have as a download at the end of the presentation, so you can all take those home and check them out in more detail.
So yeah, thanks for this. That's what I was trying to say when something ripped over here. So yeah, we have one on performance marketing. So that's really focused on, do we have access? Why are we running this campaign? And then we have one on accessibility. How are we deciding what PDFs stay on our site? Because that's been a really tough decision. We have to be compliant by April, May. So we've got thousands of PDFs. How do we start saying no? And how do we start taking what we have up there off? And so there's a whole decision tree that we've created of how to do that. We leverage data and research for objective decision making. A reason we brought in Modea, no matter what you say or what our team says, it's never as powerful as somebody who's on the outside saying the same thing, right? And Modea came in and really helped us kind of tell that story. Like I was telling before, that storytelling is a huge piece of this. So all of that was based off that, and then the research we did with our users too. So for example, our Find a Provider is sorted by availability, because that's what people cared about, was access and availability. It's also a challenge because getting availability is not always easy, but that's really what our patients are looking for. Also, making sure everyone understands the why behind every decision. So we also back up everything in our data with data. Another thing I like to know from others is, what tools are you guys using? And so here's what we're using. We're being very transparent. Hopefully we're not giving too much away, but it may look like a lot, but we've actually consolidated quite a bit. We had, I think, still have, across the university and medical center, I think 5 different CMSs. And a ton of tools where a lot of times we're actually using the same tools and just paying for different licenses. But the medical center right now, we are going from Kentico to Sitecore. That was something that we kind of using the existing technology we had. We've outgrown it, so we're moving to Sitecore. Jira, Miro, Figma, everything you see up there. Where we've struggled. Governance. I think probably many of you in this room have struggled with governance. Our governance committee in the beginning probably resembled something like a small country. It was huge. And a lot of voices, a lot of discussions, great discussions, but not a lot of decisions being made. Early on, we didn't do a great job of really getting what each person's role was and who was the ultimate decision maker. So what we were missing was that kind of top-down level leadership of saying, here are the decision makers. So that's one thing that actually, as we're doing our transformation to the new platform, we're going to be kind of redoing our governance. Content chaos, as I mentioned before, a lot of content, very decentralized, lots of people doing it. So in our case, we had 300 direct publishers to our public-facing website. We have since centralized that to a group of 30. Technical debt, for every one problem you solve, 2 more appear. When you have to depend on a system that some guy, Mike, created 15 years ago, who has now left the company, and that is your way of getting all your data management, that's an issue. So we are slowly working ourselves out of that. Cultural resistance, I don't really have to say much about that. Everybody in this room, I'm sure, is at one point or another kind of said, like, our site's special. Can you archive this? Which archive, means keep forever. Really, it was about losing autonomy. losing visibility of their site. So that's something we've had to work through. And then measurement gaps. Everybody wants to, again, want to go beyond web traffic and clicks. So.
Yeah, going to shift here now and talk a little bit about where things are at right now and some of the work that we're collectively doing to evolve the web strategy going forward. And it's really interesting what Wade just mentioned, a whole bunch of challenges that we've been facing, continue to face to some extent. There's also some other big changes going on that have caused us to want to take a little bit of a step back. The web strategy has, since 2018, been evolving sort of incrementally, but it was a good moment to step back and take a stock of the whole thing because the challenges that Wade just talked about, and also the fact that the university is changing fairly significantly. On the URMC side, there's been new leadership in the last couple of years, so that's a big transition that's been going on and forced us to come back to governance, come back to how we're communicating things, and start communicating things a little differently. And then university-wide, you mentioned the passive parent model. That's a really sort of a bit of an obfuscation, I guess, of what's happening there, and kind of an interest. It's a really important point because the connection between the university and the health system is much tighter than in many other organizations out there. And there's a big, and you all might have heard this theme in your own organizations, but there's a big unification and sort of one Rochester vision moving forward here, which is causing us to step back and take a look at the web strategy for URMC, but also figure it out in the context of the entire university. So, a bit of an inflection point, and we've stopped to ask ourselves some of these questions to make sure that as we move forward with the web and big transformational things like getting on a new platform, technology platform, are we taking the right steps? Do we have the right approach in each of these areas to make sure it's successful in the future? So I'm going to talk a little bit about where we're at with web strategy. This has been a big initiative all year so far. This year is just to, again, take a fresh look at the existing web strategy and change it in some ways to improve how things are going, address the challenges Wade talked about, and set us up for success going forward. So we always start with, making sure that we're looking at the strategy through the lens of these really important components. And so I'm going to talk about each of these and sort of the things that we've discovered and are doing about each of them to make sure we have a really great, successful experience going forward. So Wade mentioned the move to Sitecore. There was a full sort of selection process that happened earlier in the year. I'm not going to get into all the gory details of why Kentico wasn't working. If you want to talk to Wade, he'll probably talk your ear off about that. But a big part of that was just moving away from more of a legacy sort of content management system solely sort of mindset to let's look at digital experience platform, understand what that means, the robust feature set that comes with that, and frankly address quite a bit of technical debt that had just built up over the years. I mentioned earlier that we heavily prioritized the clinical experience and getting that to a great place. Well, that meant other things kind of had to suffer to some extent because their resources are limited, and what had happened was just a buildup of challenges with that platform leading to security risks and just inefficiency in general. So I think Wade and team are really excited about the move to Sitecore, but it's caused us to really think about how we're making that transition happen in a thoughtful and sort of methodical way. So data architecture. This is probably one of the areas we've spent the most time on, I would say, in recent history. You talked to Wade a little bit about find a provider and how challenging that can be. There's a similar amount of technical debt that had built up just around getting the right data to the web in support of presenting the right providers with the right sort of conditions treated and specialties tied to them and locations and all those connection points. I'd say there's generally a lack of master data management at the organization, which probably is similar at a lot of places. But that's caused a lot of challenges to users trying to go through the process of scheduling an appointment or finding other critical information transacting on the web. So there's a big effort right now, and part of the strategy here is to update the way the source of truth for that data that's going to come to the web. And we spent a lot of time thinking and talking through what's the right way to approach that. And where we've landed is with the support of the IT organization at URMC, developing a custom solution that will handle that management of the web-specific data for presenting providers and those other critical aspects of the site. There is still a lot to fix behind that at a sort of master data management level. This is the first step. Again, we're sort of prioritizing to make sure that the experience on the web is really tight and works well for not just patients, but also students and other audiences across the web ecosystem.
Yeah, and because we have 8 different hospitals doing 8 different things, the data is completely different in each place. So matching that up in a way that can be automated and not require manual input from everything is really difficult. Attended a couple sessions today, talked about one of the places we really struggle right now is with location data. Because if you think about any of the data behind the scenes, it's not just being used for marketing, right? It's being used for billing, for a million other things, right? So we've got to be able to figure out how do we take that data and making it marketing focused. And so that's been a pretty big challenge of ours. When you think about locations, it's really tough because billing wants to say that this provider can see any patient, any of these hospitals, because it's easier if they actually do see a patient. But the reality is they're never going to see a patient. I probably should have talked about this, but we're upstate New York, southern tier. So some of our providers who are up in Rochester are never going to come all the way to the southern tier. But that's the pain point of this. So we're looking at how do we show that? Do we show patient interactions? That's tough because you have new providers too. So it's one of the things we struggle with, and I think a lot of people struggle with it, as I've heard today.
We had talked a fair bit about content and the importance of that and how the team has grown over the years around supporting content. As we dug in on the content strategy part of this and how that was working and where it needs to evolve and improve, we found that it's working really great for the clinical experience right now. That focus and that priority worked. The team's doing a great job of executing that. But what is lacking is the extension of that to the academic focused websites for the School of Medicine, as well as the research audiences, just other audiences. So a critical component of where we're at with the content strategy is both taking those lessons that we've learned from what's working well with the clinical experience and bringing that over to the other sites and other experiences, but also doing a little bit of fresh work to understand what the specific needs for content are for the academic audience and the research audience so that we're not just doing a one-size-fits-all approach to these solutions. One of the challenges that we face and will continue to face is, again, the university is taking a bigger, more active role in all of these conversations, which historically has been, let's just talk about the health system, just about the academic medical center piece of this. And there's definitely a push to unify and make everything pretty much the same across the board. And so we're having to fight a little bit of a battle of saying, well, there's some unique things with these audiences, whether it's a learner or a researcher or a patient, and we need to really make sure we're addressing their needs and being thoughtful about how we're applying content in those spaces and not sort of painting a broad brush across everything.
We're also going through a rebrand too, so add on
Yes.
to this process. And yeah.
From a measurement perspective, the big push here is let's better define ROI for the site, and let's figure out how to truly measure that across the journey from end to end. So the big challenge here, of course, is being able to connect the dots between the data that exists at every stage of the journey, and in particular, while we have all of the data of what's happening on the web, it often becomes a black box once they exit the web and go to MyChart or some other downstream solution, transactionally speaking. So what we're working on now is trying to bring all that data together so that we can have centralized dashboards that report on the entire journey end to end and show that ROI in terms of actual appointments made and kept and that revenue coming into the health system. So that's requiring creation of new centralized data warehouses where we can bring that data together from the different disparate systems and report out on that through new dashboards that we're actively working on. Don't have a ton to say here on the design system because frankly we're feeling quite good about it. The design system has been around now for multiple years. We've applied it to the clinical site. It's being applied now to the academic and research experiences. The big change, big potential shift here is what Wade mentioned. There's a rebrand happening. Well, is rebrand first? It's update to the brand. And that's forcing us to take a hard look at the design system and make sure, one, that the things that are changing about the brand, we are able to easily reflect across the design system, all the components, the places where things like logo changes are going to have an impact. And also, I mentioned, the university, the unification with the university. And while we feel really great about this design system, there are some differences between that and the design system that the university side uses for their web ecosystem. So we're doing some work to look at that and make sure that we're bringing those together in the right places, but also continuing to have a unique look and feel to an extent, and something that's going to work really well for those audience that are specific to the health system. Governance, we could probably have a whole presentation on this one. But it has always been a challenge, continues to be a challenge of how do you get the right decision makers together with the right level of authority, and not just getting those groups together and having the conversations and communicating, but also a change management process that will actually support it happening and those decisions being executed, and the continuation of that communication to make sure everyone understands what happens and doesn't forget what you might have decided, months or even years ago. One of the things we've done here, and you alluded to this, Wade, but I think an interesting note with URMC is that you have a really great collaborative relationship with the IT organization. There's an application development team within the IT org that partners really closely with Wade and his team to build and bring these experiences to life. And they have a really mature approach to technology governance, shocker. And so this diagram is actually sort of stolen from them to an extent, and working closely with their chief technology officer and saying, how can we take the things that you've learned and the things that are working well for your organization and apply them here to how we're managing and evolving technology from a marketing and communications perspective. A couple of key things here is, one, the establishment of a charter, not something that we had, I think, ever before, right, Wade? It's like a formal charter that's signed off on by the CEO that says, here's what we're doing, here's how we're going to invest in it, here's our goals and our priorities, so we can always point back to that and say, hey, we're making this choice because of this, reminder. And then so that's going to be a big positive change. The other thing is getting the right groups of people together. So that's where we're really leveraging the IT organization's approach to how they structure committees and groups and the layers of governance to make sure communication is really effective. And it's something that has already been really aligned on and sort of something that's worked for quite a while for them across the organization and across the university as well. It keeps coming up. There was a big sort of university enterprise-wide HR solution overhaul and change, right? So what worked well there, what didn't, and how do we apply that here for another enterprise-wide initiative that we're managing?
And I can't stress the importance enough of decision documents. If you're not doing decision documents now, do them. I can't, almost every month somebody comes, who made that decision? Who made that decision? And we can go back and say, it was done on this date by these people, and we can revisit it, but this is when we made it, and here's who was involved. Without that, we would have been in a lot of trouble.
So you made that decision, Dr. Genius.
It was me. Dr. Genius.
All right, and I'm going to hand it back to Wade to talk about where the roadmap is going.
All right, so before I showed kind of that cycle, we're going through that cycle again right now. So we have been through the cycle, we continue to go through the cycle, we are redoing the cycle. So everything we just talked about, there's a rebrand, this reunification, we are back to kind of year one, what we did back in 2023. So we're kind of reassessing, realigning as we build a new foundation on Sitecore. Really, and you'll see in a second, kind of moving to simplifying, standardizing, also keeping the business running while you're doing all this. That's a real challenge, right? We spend probably about, I think the good zone is about 60% of our time on keeping the business running. And then about 40% kind of really on feature focus, kind of where we're going. Before, during COVID, we were like 90% keep the business running. We've been around 80 hovering, but now we're getting closer to that 60%. So the road ahead, as I mentioned, we're rebranding, replatforming, and Sitecore, now AI, I think, they just announced. The accessibility and privacy is ongoing commitments. Again, we hired somebody on our staff to do that. I will say that that person is very busy. We were afraid at first that they may not have enough to do, but there is plenty to do, especially as we're doing PDF accessibility now. And then aligning brand tech governance with the university ecosystem. So right now, it's about modernizing the foundation. 2027, our roadmap really goes to about really focused on expanding and unifying. And then 2028-29 is differentiating and disrupting. I wish we could be there in 2026, but the reality is we're not there yet. There's a lot on the operational, foundational that we have to get right. Before about talking about shiny new tools, AI, everybody wants to be there, but it doesn't work unless you have a strong foundation and you get the stuff fixed on the data side. We are not there yet. We have probably 5% of our providers on open scheduling right now. Unfortunately, that's not something we can push it forward and really tell the story about why it's important. But it really is on operations to get our scheduling templates correct and the nomenclature right. All right, like I said before, I didn't want to be a talking head this whole time. I really want to open up the conversation. I value kind of these peer-to-peer relationships, and I open it up to questions.
Yeah, real quick before we do questions, I mentioned earlier we have a download available with some of those decision trees that Wade put together that I think are really great. We also have a white paper on technology selection that's in that package too. So if you're going through that right now, a lot of good information that might help guide you to making a smart choice. But yeah, questions?
I don't know how to pass the mic.
My question is about the condition-based architecture that you ended up choosing. I was wondering what were some of the user insights that made you choose that architecture, and then also the labeling that you chose. How did you go about that?
So yeah, like I said, we were very department-based, and when we did our user research, nobody got what our departments meant. They would get to a department page and be presented with, because we're an academic medical center, training opportunities, education opportunities, research opportunities, but we really wanted to focus on kind of these clinical. So we looked at a lot of data. We looked at our analytics to see kind of, it really focused on those condition-based navigation, condition-based pages, and it really worked well for the content hubs that we created. Does that answer your question? Mostly?
Yeah, I would just add, I guess, the reason for leading with conditions and that aspect of it, I think, was born largely out of some journey mapping work that we did based on the research learnings, which showed different pathways that patients would be coming in, different questions they might have that needed to be answered when they hit the website. And we found, I think, by and large, that in a lot of cases, they weren't necessarily doing their research on the site, but once they got there, they wanted to understand, okay, what can University of Rochester Medicine do for me to fix this problem that I have? And so showing the connection between the conditions that University of Rochester Medical Center treats to the right doctors that will treat those conditions and places you can get that care was sort of the approach that led a lot of that decision making.
And our departments are still represented on the website, but it's on the academic side. So on the clinical side, we really point to, they have a department page, but it really leads to kind of more of the education research stuff. Yep. On the clinical side, it's all conditions and treatments.
There was another question over here.
I'll ask a question. Can you give me high-level general reasons, we can talk more in detail later, but why you chose to move away from Kentico?
Bryce said I could talk on the subject, and I really could. It's not Kentico, the platform, as much as it was the support, honestly. The investment in a CMS, DXP, whatever you want to call it, is really on how you use it. When we started with Kentico 20 years ago, it was built in a way that did not really support what that CMS did. So it worked for us for a while, and it probably could have worked years on, we were missing the personalization piece of it. That was a big point. The biggest one was support. Kentago support wasn't what we needed at the time. We had to, when we were doing the transformation on that platform, we really depended on one person who then took a job at Kentago. So it was really support more than anything.
I would just add that part of the impetus for the move was Kentago end-of-lifing the version that they were on and wanting them to move to the new sort of DXP version of Kentago. And so that sort of forced a hard look at what is the landscape and what are our options here, because we're going to have to do a migration either way.
We went through a very painful migration, and nobody, either us or IT, wanted to go through that again.
I was just curious, you mentioned personalization. How do you guys think about that? Are you building out authenticated web portals, or how are you approaching that or thinking about it?
Great question, and we aren't there yet, honestly. I'll be very honest. We are really at the start, especially as we think about data privacy and security, of how can we do that in a way. A year or two ago, when we were going through a lot of the data privacy and security stuff, there was really a couple decisions. It was one, take it all down, right? Two, it was doing it in a compliant way using a tool. We use FreshPaint currently. Or taking the risk, and we didn't want to take the risk. So personalization, I think, we'll get to. Hopefully with Sitecore, learning more about kind of what our options are there. Doing it now that we have somebody who is focused on security and privacy, doing it in a responsible way. So to answer your question, we're not there yet. I wish we were, but that's really where we're going to try to differentiate in a couple of years.
Well, I think we're at time, so appreciate everyone coming and listening.
Thanks,
and
everybody.
hope you all have a great rest of the conference. We'll hang out up here a little bit longer if you have questions and want to talk more.
Appreciate it.
Thanks, everybody.